Coronavirus is surging in the United States with the death toll now over 127,000. Hello, I'm Mike Walter filling in for Anna Naidu, and this is The Heat. COVID-19 cases are showing a sharp increase in several states across the United States just days before Americans celebrate their national holiday on July 4th. Tens of thousands of new infections are being reported daily, with the states of Florida, Texas, Arizona, and California all hard hit. And this week, Dr. Anthony Fauci, the nation's top infectious disease doctor, warned the crisis would get much worse.
We can't just focus on those areas that are having the surge. It puts the entire country at risk. We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around, and so I am very concerned.
The pandemic, of course, also has major economic and political implications for the United States. And to discuss all of this, I'm joined now via Skype from Ohio by Danielle Rhubart. She is a postdoctoral fellow at the Lerner Center for Public Health at Syracuse University. Also joining us from New York is Susan Tehrani. She is a journalist and political commentator from Dallas. We're joined by Seth Denson. He is the president and co-founder of GDP Advisors. And with us too via Skype from New York is Aaron Mate. He is host of Pushback with Aaron Mate on the Gray Zone. He's also a contributor to The Nation magazine. Welcome all of you to the show. Danielle, why don't I start with you? If you want a shock to the system, I don't think you can ask for more than Dr. Fauci's testimony. The potential of 100,000 cases a day. What was your reaction when you heard that?
That number sounds surprising, but at the rate that we're growing, it is in the realm of possibilities. And really what it doesn't capture is, in fact, the impact it will have on mortality, right? Our hospital systems don't have the capacity to handle numbers like that. And so we can expect to see particularly racial and ethnic minorities, as we are seeing right now, being underserved and their mortality rates ending up higher as well. It's also important to note just very quickly that right now this has largely been hitting urban areas, not entirely, but mostly. And at the end of the day, the rural areas of the country have higher shares of people with pre-existing conditions and older adults who are more susceptible to mortality from this. So we could see the mortality rate uptick much quicker as well once community spread continues further.
Yeah, well, to go just a little bit further on the rural communities, because a lot of them don't have a lot of hospitals either, or doctors for that matter.
Yeah, over the past 10 to 20 years, many rural communities have lost their primary care physicians and their hospitals. And so you're looking at some communities that have an hour, 2-hour drive to get to their nearest doctor. And at the end of the day, they may get there and there might not be even the facilities to be able to handle their needs. And so right now, right, things are being handled, but as community spread continues, we have to be thinking about the vulnerable populations who are most susceptible to passing away from this virus.
It looks pretty dire in some respects. Susan, I know you've traveled and reported from a number of areas, Iraq, Iran, Lebanon, Egypt. Give me your sense on how the world community is viewing the United States. We know the EU has this travel ban. They're not allowing Americans in because they're concerned about these spikes.
They are. They're watching the United States very carefully. First of all, as one of the countries who's leading the coronavirus pandemic, but also one of the countries that's usually part of the solution when it comes to a global fight against a pandemic like the coronavirus. And, you know, recently there was the Senate Committee on Foreign Relations panel from a group of global health experts who came out and said that the United States, you know, trying to threaten to leave the WHO was probably one of the worst decisions it had made, considering the fact that a pandemic like COVID needs international surveillance, and the United States might be too ambitious in trying to figure out that it can lead alone single-handedly an issue like this, considering the fact that it's at the forefront of combating the pandemic right now. And as harsh as it may sound, these experts were saying that, and they were global, they were from the United States and elsewhere. The United States needs to, first focus on its own borders before trying to, find a solution for other parts of the world as well. So this sense of unity among other countries to come together to fight this pandemic is very strong right now. The European Union is standing very strong with each other. Other nations are working together to try to find a unified solution to this. And, people are wondering and looking at the United States right now, especially at the United Nations, and wondering whether or not the United States is being perhaps too ambitious with the current administration in thinking that it can handle this pandemic on its own.
Seth, you're in one of the ground zeros. You're in Texas. We're looking at states, Florida, for example, Texas, Arizona. They all have Republican governors. All of those governors were anxious to get the economy revved up again, get people back to work. Were they too ambitious?
Well, I think you've got to start to look at this in a different way. It's easy for us to, I think, look through this as either a healthcare lens or an economic lens. But the reality is those two things are very much linked. And when you have a situation where we've effectively shut down our economy, you have to start understanding the underlying healthcare consequences that can come from that. And so I think what many of these governors were doing was surveying things. Here in Texas, for example, you're talking about 27 million people over nearly 300,000 square miles. And so you've got a vast population spread out. And so while we are certainly seeing hotbed areas in areas like Houston and even here in Dallas, areas like Midland, Texas or San Angelo, Texas are seeing a very different response. And so to paint these states and even these areas with a broad brush saying that they're all equal, I think creates a challenge economically that we can't overcome.
It's interesting, though. Hindsight, obviously, is always 20/20. But Texas Governor Greg Abbott said earlier that if he could go back in time, he would have been slower to open up the bars in the state. Right now, today, 8,000 new cases, a single-day record. What's the sentiment of people that you talk to there in Texas?
It's mixed. I mean, you certainly have those that are being much more cautious. I personally don't go anywhere without wearing a mask. Until I'm on camera, of course. But I think that there is a mixed sentiment. And this is the real challenge here. And this is a problem that does not have a political agenda. Coronavirus doesn't care if you're Republican, Democrat, a Trump supporter, or Biden supporter. And so I think what's happening, though, is we are seeing this somewhat drawn down party lines. What we have to start realizing, though, is that for those entrepreneurs that started and opened that bar to be shut down by the government without a real safety net, yes, we can talk about CARES Act and PPP money, but the reality is these folks have a dire situation ahead of them, and to compare maybe myself to them really isn't a fair comparison at all.
Aaron, we're talking about state governors. Many of them, as I said, Abbott in some respects kind of, if he could go back in time, would change some elements of what he's done. David Frum is out with a rather critical assessment of Trump in The Atlantic. He's titled it, "It's Trump's Plague Now." And he's not the only one to say that. Of course, Joe Biden, who's running against Trump, has also come out with a rather critical assessment. Let's have a listen.
It didn't have to be this way. Month after month, as other leaders in other countries took the necessary steps to get the virus under control, Donald Trump failed us. Month after month, as many of us urged him to step up and do his job, he failed us.
So let me ask you this, Aaron, your thoughts on this. We're also seeing polling that's really showing a lot of Americans kind of siding with Joe Biden. He's losing, at least at this stage, in a lot of these, states that he really needs if he's going to win in November. And we have this new poll out. It says that he basically pushed the states to open too quickly to boost his reelection efforts. I want to get your thoughts.
I think all the criticism is fair. I mean, look, even before the pandemic hit, what did Trump do? He closed down some vital positions on the National Security Council that were tasked specifically with dealing with pandemics. And I think that cost the U.S. He also cut back cooperation with China, so he reduced the number of U.S. officials who were on the ground working with the Chinese CDC to monitor for exactly situations like this. And then what happened when the pandemic hits? in early January that China warned the US government. The genome was sequenced. So we had a pretty good understanding of what this was pretty early on. Other nations prepared, and that's why their casualties were just so much less than the US, which has, what, about 4% of the world's population, but about a quarter of its reported cases and deaths. So it's unacceptable, and I think huge responsibility does lie with President Trump, who has, since his hit, has sent a bunch of mixed messages. He disparages and makes fun of people for wearing masks in public. He holds these events like recently in Tulsa. Now he's holding one on July 3rd at Mount Rushmore. He has pushed remedies that don't have scientific merit to them. So his handling of this has been all over the place. The one thing I think that is not his fault and that he inherited is that we have a healthcare system, unlike pretty much anywhere else in the world, where it's a for-profit system where your healthcare is tied to your employer. And I think the fact that we have that system, which is not Trump's fault, has made this pandemic even worse because it's left people without vital care and vital options to get care when they get sick.
Aaron, today he basically doubled down in an interview with Fox. He said, I think we're going to be very good on the coronavirus. And again, saying it's sort of just going to disappear. Give me your thoughts on that.
I mean, it's ridiculous. He said this isn't the first time he said that it's going to disappear one day. He's living in a fantasy land. And I'm surprised actually that it hasn't cost him even more in the polls than it already has. I suspect if the current trends hold, it will start to cost him, because how can people look at what we're facing with, a record number of cases just being reported, highest number of cases in the world, and Trump is still going on TV and saying that one day it will just disappear. I mean, it's magical thinking, and it's a farce. The whole world is laughing at us because it's just so ridiculous.
And Seth, can he turn this around? Can he do a course correction? Do you think it's wise to be out there saying it's going to sort of disappear when, again, I pointed out in Texas, a single-day record there today, and we're seeing spikes all over the place?
Well, I certainly don't want to speak for the president. He has people that are well qualified and polished to do that for him. But what I can say, though, is with regards to our healthcare system here in the United States, let's recognize that, yes, Trump didn't inherit the system, but the vast majority, roughly by most estimates, about 70% of all innovation comes from the United States of America. The rest of the world benefits from government-run healthcare because we don't have it here. Our innovation comes from our free market capitalistic system. Companies like Gilead, who are providing remdesivir and some of these other things that are actually starting to make a difference. And while I think this president is trying to certainly be as optimistic as possible and maybe getting out ahead of the skis a little bit too much to do that, I do think that it is our free market healthcare system that will pull us out of this crisis.
Aaron?
Well, it's funny, the mention of remdesivir. The WHO just criticized the U.S. because the U.S. has just purchased pretty much Gilead's entire stockpile of that, depriving the rest of the world of an opportunity to try it out in their COVID treatments. And that, to me, is not free market capitalism. That is state capitalism, where the U.S. uses its power to buy up the entire stockpile of a drug that the whole world can use. And it goes against what the WHO standard is, which is sharing drugs and medicine equitably. In terms of, in terms of this notion that our free market healthcare system will save us, I mean, look at the reality right now. As I said before, we have 4% of the world's population, 25% of the world's cases and deaths. I mean, and that you can look at that and say, all you want, but I don't think you can separate that from the fact that we have a healthcare system, unlike any other, which prioritizes profit over people. And what it means is that people are not getting the treatment that they need because they don't have health insurance, either because they didn't have a job before this hit or they lost their job after it hit. And it means that some people who do get treatment, we're seeing horror story after horror story where they're now being stuck with these massive bills for going to the hospital and getting treatment that they can't afford. So what we have is a nightmare on top of a nightmare, and I do not think that our current healthcare system is equipped to handle it.
Danielle, let me ask you about a story that just came out from the AP. They say that the U.S. public health system has been starved for funding for decades, which I think we all are well aware of. They profiled local healthcare workers who are working 7 days a week now because of this. They're facing public backlash. They also have fears that they'll lose their jobs as well. Since the recession, more than a decade ago, 38,000 state and local public health jobs have simply vanished. How serious a problem is that?
It's a serious problem, especially during a pandemic. What we're also seeing is that loss is not evenly distributed across the U.S. So we have healthcare deserts and pockets where we're seeing the impact of that more so than other areas. And so as we think through the next likely at least year of this pandemic, it will be the communities with the fewest resources to be able to fund hospitals, the largest shares of folks who need healthcare, and the largest share of folks who are typically left behind, racial and ethnic minorities, who will likely be hurt the most by that lack of health care.
Susan, we've seen people who've been starved for that interaction. They've been holed up in their houses, and once the things started to ease, we saw a lot of people going out to the beach and different events and gathering, and then of course we started to see these spikes. 4th of July is just around the corner. What are some of the fears that we should have in terms of additional spikes, do you think?
You know, we saw these kind of social distancing rules and regulations ease up on the one hand, and just to follow up on the healthcare issue, one problem that the healthcare industry is having right now is that people are having a difficult time. Doctors and hospitals are having a difficult time in bringing in patients with symptoms like, just not regarding COVID, but with heart disease or diabetes. They're having problems with bringing these patients back into the hospital because of the fear of a spike in COVID. So on the one hand, we have to really pay attention to the numbers, but on the other hand, there is that kind of sense of fear among the public that might not be exactly correct in terms of the information that they're getting. So that's something that people are concerned about as they gather. It's not just the social distancing or wearing the mask that's become highly politicized right now, that it's really a blue state, red state situation, but it's also going to the hospital when you're sick and how doctors are treating you. I mean, these all fall into that category as well.
Seth, you brought up the economic piece of all of this earlier, and I heard one business owner today saying that you can't go for several months being starved of oxygen, and of course what he means by that is revenues, your business will just go under. But he said if you reopen and you start to build back up again and then have to close back down again, that could be curtains for businesses all across the country. And we are starting to see some states where they were starting to make moves, relaxing things, and now kind of reining things back in. What's that going to do for some of these small businesses across the United States?
Well, I don't think there's any question it's going to be detrimental, but keeping them closed would be detrimental as well. And I think it's easy for us to Monday morning quarterback or look at this through just a healthcare lens or just an economic lens. And this is the challenge that we have, is that we tend to lean to one side or another based on the narrative of the day. And to that business owner that has that business, that's their livelihood, that's how they put food on the table for their kids. Listen, I'm a parent. And the idea of catching coronavirus terrifies me. But if you were to tell me, feed your kids tomorrow or go out and take the chance against coronavirus, I'm sorry. I'm taking my chances every day of the week. And this is the reality that many Americans face. And it's easy for many to go on television and talk about we opened too soon or we didn't do the right thing. But you're not talking to the everyday American who's looking at their life that they've built fall apart in front of them because they've been forced to shut down. And this is the real challenge that we have to find a way to come together around.
Aaron, Seth's talking about the business owners, but we also know that a lot of those employees who are out of work are also struggling. There's been a lot of talk about evictions and some of these other issues. Take this down the road a piece for us. I mean, what are some of the economic hardships we're going to see for just regular folks out there?
Well, look, I think this is where, everybody has a common critique in that it's totally fair for a small business owner or for an employee of a business, however size, to feel frustrated. But this is where I think the federal government has really let everybody down. People did their part. Everybody stayed indoors, they socially distanced for many months. And during this time, the federal government, and this is where I think Trump has primary responsibility, but not just him, didn't do its job. They didn't prepare properly. They didn't roll out a comprehensive testing and contact tracing program. And Congress didn't pass what people need. Congress could have passed measures that cover everyone's health care so that people don't have to worry about that. They could have taken care of Main Street the same way they took care of Wall Street. So we saw, just as with the housing crash in 2008, we saw, trillions of dollars opened up for Wall Street, but not for Main Street. So it's totally understandable everyone's frustration. And I don't fault those who want to reopen prematurely. It's fair enough because people's livelihoods are at stake. But this is where all of us, I think, should be putting more pressure on our federal government to do what it has the power to do, which is to take care of everyone's needs that are currently just not being met.
Danielle, Aaron's bringing up contact tracing. I mean, it seems like if you look at some countries like South Korea, China, if you look at New Zealand, there does seem to be strategies that you can employ to really kind of mitigate this. Did the United States drop the ball?
We see some states across the country that have pulled together resources to build up their contact tracing workforce, and that's wonderful to see. There has been a lack of coordination from the top down, and a number of states are falling behind it. If we reach 100,000 cases per day, there's no amount of contact tracing that's going to be able to keep up with that. And just to piggyback off of what some other folks have been talking about, these numbers, when we start looking at the mortality numbers around COVID, this doesn't count the deaths of despair, right? The suicides and the drug overdoses that are related to the social distancing and the economic deprivation that has come about because of this. And I just had a brief come out today on heat-related deaths, right? If we are closing cooling centers, if there are fewer places for folks to go, we can expect those during what is expected to be a record heat summer to also increase. So there's a lot of factors and a lot of impacts that we aren't fully capturing when we just look at the numbers of who's being tested and tested positively for COVID.
Of course, a lot of people pinning their hopes now on a vaccine. Dr. Fauci spoke about that as well earlier. Let's listen.
There is no guarantee, and anyone who's been involved in vaccinology will tell you, that we will have a safe and effective vaccine. But we are cautiously optimistic, looking at animal data and the early preliminary data, that we will at least know the extent of efficacy sometime in the winter and early part of next year.
So Danielle, give me your sense. What's the worst case scenario? What's the best case scenario? I mean, they're really trying to speed this through. What's the earliest we can expect this, and what actual impact can it have?
Yeah. So if best case scenario, a vaccine comes forward that has the efficacy to move forward with large scale manufacturing, we're looking at least a year out from now before a good share of the population has actually gotten that vaccine. We have to note, though, because of the anti-vax movement, as well as concerns about the pace of vaccine development, unfortunately, there will be folks who will be hesitant and will want to wait and see. And so even if we are able to develop a vaccine quickly, there's concerns about how long it's going to take before a large enough share of the population has actually received it.
And Danielle, researchers are also debating how to expedite moving this vaccine along even faster. One thought is to actually infect people with the virus on purpose so that they can test the vaccine. That's described as a human challenge trial. Does that present any kind of ethical challenges?
For sure. If history has taught us anything, it will likely be the folks with the fewest amount of resources and are already the most marginalized in society who get recruited to those studies. If and when those studies don't prove to be successful, that will be on our hands as a society.
Aaron, talk to me about different states and how they're approaching this, because we've got 37 states now seeing jumps. California is actually rolling back things. Ron DeSantis in Florida is kind of charging ahead. He has said that the K through 12 public schools will be reopening at full capacity. Give me your sense on what we're going to see in terms of one state's reaction versus another as we kind of thread the needle as the months ahead unfold.
It's interesting. It speaks to how unpredictable and just how widespread this virus is. The fact that California was on top of it relatively pretty early, seemed to have contained its cases. Now it's seeing an explosion and has to roll back some of its measures. I think the overarching lesson here is that we can't be relying on the state-by-state piecemeal approach. We are lacking a coordinated federal response. And this is where Trump and his circle have really failed us and not stepping in and basically leaving it up to the states to do each thing according to their own direction. It's not working that way. And now we're seeing the states, out west and in the south that initially were not that hard hit. Now they're being bombarded, and who knows when that rebounds back to the states that have managed to reduce their cases, like New York, which is doing a little bit better, but is still struggling. So it just, to me, whatever each state does, I think it's all crying out for a coordinated top-down federal response.
And you mentioned New York. There's sort of a consortium of some of the governors, some of these states saying they don't want people coming from other states to visit because of the fact that they may be bringing the virus with them.
Yeah, and that's fair. You can't blame people for that, because it's a scary time, and it's this awful time where we all have to make sacrifices. And when you don't have, I think, leadership coming from the top, from the White House, it leads to this sort of chaotic free-for-all atmosphere where no one quite knows who to trust, who to listen to, especially when you have the president and vice president, for example, refusing to wear masks in public. That's something very basic they could do to show an example for everybody about what kind of minimal precautions to follow, but they won't even do that. So every state in its own way is suffering from the mismanagement of Washington.
Susan, Deputy Director of the Centers for Disease Control and Prevention, said this week that the coronavirus is spreading too rapidly and too broadly for the U.S. to bring it under control. How long is it going to be with us, and what needs to happen?
Ultimately, I would agree that we really lack leadership on the coronavirus right now, and it's evident. I mean, one way to put it is we're in an election year, and the White House perhaps has decided to basically drop the ball on the coronavirus issue because it knows that it's a losing issue, and perhaps it's more comfortable for the President of the United States, Donald Trump, to be an economic cheerleader rather than deal with the nuances of a public health crisis. Although I do agree that these two right now at this point really come together and have to be treated as something that are complementary to one another. But the White House doesn't see that. So as long as there isn't a coherent understanding on how to move forward, and as long as the issue is being so politicized to an extent where wearing a mask is politicized and is considered a lack of freedom of speech on the one side and a lack of a public health issue on the other side, and it's about being a patriot or not being a patriot, then we're going to have these conversations. And I think, to follow up to what I was saying earlier, I think the world is watching and wondering why this issue in the United States, the public health issue and the economic issue and the presidential elections are all going hand in hand and cannot be really dealt with in a way that's not so politicized. So I think that's the concern that many people have right now. But at the end of the day, it does come from the leadership, although the separation of power in the United States is set in a way that governors do have responsibilities.
Susan, we're going to have to leave it there. Thank you all for joining us. Really appreciate it. That is this edition of The Heat. I'm Mike Walter, filling in for Anna Naidu. Thanks so much for watching.